Hi, and thank you for joining us for Cave Talks. I'm Kimberly with My Quiet Cave, where we provide space for faith and mental health. And today we have Barb Torgerson. Barb is a licensed clinical social worker, and you're in private practice here in Denver.
Yep.
Denver, Colorado at Wild Salt Counseling. And Barb, you specialize in severe and persistent mental illness.
Yes.
Is that correct?
Yes.
That's a hard population to work with.
It is, and there are a lot of different. I mean, it's a wide range of mental illnesses. So yeah.
Well, today I'd love to talk with you about bipolar disorder.
That would be great.
Okay.
Yeah.
First, maybe we can just start off with just kind of a clinical definition or how you would define bipolar disorder.
Yeah. So it's on a spectrum from the most mild, which we often call cyclothymic disorder, and that is very mild mood swings where people go really up and can be very excited, and then there's mild depressive episodes. When you get into full-blown bipolar disorder, there are two types: bipolar 1 and bipolar 2. Bipolar 1 disorder is characterized by very severe manic episodes, and this can include lots of overspending, hypersexual behaviors. People can often think they could be the president of the United States or the world. They often, the mania also can be characterized by a lack of sleep. People going for periods of time where they maybe sleep an hour or two a night. And that then leads to, obviously the body can't handle that for long periods of time. And so then what happens is there's a crash and there's very severe depression, often manifested in suicidal thinking, suicide attempts, hospitalizations. So that's bipolar 1 disorder. And the other thing that can happen in the manic phase when it's very, very severe is it can result in psychotic episodes. So hallucinations and delusions, and people thinking, people are chasing them. I mean, it's a very tough, bipolar 1 is really a tough disorder to have and tough to manage, and often it really does require medication. And then there's bipolar 2 disorder, which is somewhere in between the cyclothymia and the bipolar 1. So it's not as severe, but it can also result in high highs and low lows and suicidal thoughts. And again, sort of delusions of grandeur, but not as extreme as bipolar 1. So that's really a kind of a broad definition of bipolar disorder and the different types.
Can you tell me kind of how this would look like in the average person, like daily?
Yeah. So, it depends. The other tricky part about bipolar disorder is sometimes it's rapid cycling, and sometimes people go in longer cycles. Oh. So it's very hard, on a daily basis. And again, it depends on, some people can function with their bipolar disorder and they can manage it, and other people it really does require hospitalization. So on a daily basis, people can be going through their daily living and daily lives, and all of a sudden family members will start to see this, gosh, they're really positive right now, and wow, they're really positive, and they can do a lot. I mean, it's in the beginning of a manic phase, the person who is struggling with it and their family members, they are often like, yay, this is great. I can do so much. I have so much energy. That's the beginning. And so you think they're doing really well. And then people start to notice, you're really, really too hyper. And you are saying things that sound a little bit off. When people start saying, I'm going to be the next Tolstoy, I'm going to write a novel that's going to be the greatest novel of all time. And they may start ignoring people in their lives. They may start ignoring sort of their regular tasks and just getting hyper focused on something, and then they start losing sleep. And they might start talking really fast. And that's when you know you've really entered the sort of the danger zone. And then depending on how long that cycle lasts, what comes after that is a slip and another slip. And often then, bathing kind of goes. They start to really slow down, sometimes crying. They're not understanding, where did my energy go? Self-esteem goes, and they really start to doubt themselves, and then they fall into a depression. And the depression is, especially if they've had a really high, that depression is, people really feel like they're worthless, and they don't understand. They're like, what happened to me? Where did I go? That person that I was when I had all this energy, where did that person go? And then it's really hard for family members, because they're like, I'm not sure where that person went. And then if it gets severe enough, then there's the suicidality that comes with it, and they start really believing that their family and their friends would be better off without them. So that's kind of really the daily life, and then things will start to swing again, and they'll start to feel a little bit better. They'll come out of it. In the more mild forms, sometimes people just have a lot of energy. With bipolar 2 disorder, a lot of times it doesn't get diagnosed for a while, because often it's diagnosed as just depressive disorder, because they'll be down and down and down, and sometimes suicidal. And people are like, oh, you just need some antidepressants, which then they're put on antidepressants, and then their manic phases, hypomania or mania, start to get more severe. So, but in the beginning, a lot of times it's like, wow, you've got so much energy, and it doesn't go to that like weird crazy town place. Like, what are you saying? No, you can't be president of the world. That with the bipolar 1. So with bipolar 2, it's just like, wow, she's got a lot of energy. She's getting a lot done, and that's great. And then the depression. So again, it really depends on the type and how severe it is. So that's kind of what daily life looks like for someone who is living with bipolar disorder. Yeah, so does that make sense?
It does. It helps, because we know some people that we get mood swings, or they're just in a mood. So that's what I wondered, how we can differentiate between that. Is it just somebody with mood swings, or
right? And the funny thing is, sometimes especially in kids, and I know probably we're not talking as much about kids, but sometimes trauma can look like bipolar disorder and vice versa. Sometimes ADHD can look like bipolar disorder or vice versa. So I always want to tease out, is this, when I talk with adults, I get a full trauma history, right? If they're having mood swings, so this is a fair question, right? If they're having mood swings, what I want to tease out is this trauma, or do you have ADHD that's gone undiagnosed and you're just like kind of all over the map? Or is it bipolar disorder, which is an organic illness that is really chemically based. Trauma affects the brain, but it's not an organic, like you're born with the right chemical makeup, and then when you hit your usually it's late teens to early 20s, when we really see bipolar disorder start to really manifest. So, and symptoms of trauma, if they've had traumas in childhood, you can look back and see their history and go, okay, these are not just, these are not bipolar disorder or mood swings, but they're related to your trauma. So you really do need to tease out as a clinician, which is which. So, yeah. And it's hard when it's both, because sometimes it's both. People who with severe and persistent illness often have really big time trauma backgrounds. But yeah, then you look at when they turn 17, 18, 19, and you go, oh, there was a distinct shift. Things got a lot worse. And that's why it's hard for families, because their kiddos sometimes will go off to college and they'll get a call from a roommate or a professor, and someone is saying, your kiddo left campus and has been gone for 3 or 4 days. We have no idea where they are. And then then they'll actually show up, several days later and be really disheveled, and everybody's really confused. And it's not just normal, oh, you went off to college and you're stressed out. So again, it's a tough disorder because of that. So yeah, so I always say to parents, if there's any history of mental illness in your family background, you just need to be a little more aware when your kids hit, between 16 and 25.
Is that when it starts kind of coming out and
Yeah.
you can see it?
Yeah.
Okay.
And onset can happen later in the late 20s, but the vast majority of bipolar disorder, and it can hit earlier. I mean, when I was working exclusively in child and family work in a community mental health center, we would have kids 8, 9, 10, where it was real clear that that's what it was. With bipolar disorder, it is critically important to get intervention as soon as possible. And I mean as soon as possible. And you need the medical help, you need psychiatry, and you need therapy involved in the person's life. They need to have regular contact with the medical professionals, the psychiatrists, and they need to have, especially in the beginning, they need to have ongoing therapy with someone or a team that really knows this disorder. And the family, I always say, even if your family member, you're seeing it start and you think something's really wrong, even if the individual won't go to therapy, I say to family members, get yourselves into therapy. If it's a mom or dad or brother or sister, start finding a therapist. And community mental health centers are typically the number one resource because they have a team. I'm in private practice and I see people with different mental health diagnoses, but if it's really severe and it's going to require hospitalization, I will often refer to a community mental health center, because in the same building they'll have the psychiatrist and the therapists and case managers who can help the family find other resources, and they're very familiar with the court system. So if somebody needs to be put on a 72-hour hold, if they're a danger to themselves or to others, that mental health center, they're used to doing it. They do it all the time. And that's my background. I've worked in community mental health for years before going into private practice. And it was always so nice to know, hey, there's a team here. And families can say, I need help, and they can get the help. And there are national organizations as well that people can talk to. And then if nothing else, they can call the national hotline, even for suicide prevention.
Okay.
and say, okay, I don't know what to do, and they can direct that family member to kind of a resource. And I know community mental health centers are nationwide, so in every state there are these resources for people. Yeah. So yeah,
that's an awesome resource then.
Yeah, it is
kind of a one-stop shop almost with lots of things.
Yep,
and it's interesting you say that the supporters and family members, you suggest they get counseling as well, because I've heard that with a lot of these talks that we're doing on different disorders. That's kind of a recommendation.
It very much is. And sometimes family members are they'll encourage the individual, right? Their loved one, you really need to see a therapist, or maybe you should go see a psychiatrist. And it's just so hard, because with bipolar disorder and some others, the individuals think, I'm fine. What's wrong with you people? I'm not sure why you're complaining. Especially if it's mania. And the person's like, I don't need any help. I'm great. And then they crash. And in the crash period, they're so low that they also often don't want to go and get help, because they're just exhausted and suicidal and crying, and they're like, I don't even want to leave the house. So it's really important for family to get the help.
So what does recovery look like?
So recovery is, the neat thing is with bipolar disorder, especially bipolar 1, when you get the right medication regimen and you're in a place where I call managed, where you're managing your bipolar disorder, it means that oftentimes people can work, right? And they can have successful relationships, but it's really staying in touch with their team. It's staying in touch with family. And I can't say this strongly enough, as I'm just going to look straight at the camera and say, if you've got bipolar disorder and you're on a medication regimen, when you're feeling better, don't stop taking your medications. It's really important to continue with your medications. Because when you feel good, often people will say to me, I think I want to try going off my meds. And I'll say, if you're under the care of a psychiatrist and you want to try dialing it back a little bit, great. You work with your psychiatrist on that. But if you find that you start dialing it back a little bit and you start titrating off and you have symptoms again, you need to bump back up on the medication. And so, it's about feeling good. It's about staying in what I call a normal range of mood, where, all of us, we have days that are good and days that are bad, and that's normal. But these cycles that are so high and so low that it really interferes with your daily life, that's not what we want. So recovery is really about trying to find a norm for yourself, and being able to go to college or being able to hold down a job, and again, have kids, family, if you want to do that. So and the other side of it is sometimes you're going to need pretty consistent family support. It's just
it sounds like it's
a
manageable.
Range. It's manageable. It can be manageable.
But it's probably, or it could be something that you're going to manage for the rest of your life.
Right.
And I kind of think of that. There's lots of things that all of us struggle with, and we manage. I think of diabetes as one of them. You know, if you have to take insulin or if you have to take shots, you can still live a full life.
I know.
But you need to continue to take your medication.
It's interesting you say that, because diabetes is one of the main. When I get somebody in my office and they're like, I shouldn't have to take meds. I shouldn't have to. I should be able to deal with this. It's just in my brain. And I use diabetes as the example. Would you tell a diabetic to not take their insulin? that they should be able to manage themselves, and people, it'll often stop them sort of dead in their tracks, and they're like, well, no, it's a physical illness. And then I say, and so is bipolar disorder.
Right.
It's a physical illness. It means that the chemicals in your brain are not working appropriately, just like the chemicals in a diabetic's body are not working appropriately. So, yeah.
I like where you put that. That's the first thing I think of, but you're right.
Yeah.
So often we don't think of it as being physical because it's in our brain, and we don't see it. We're starting to. There's a lot of really cool things going on with that.
In your brain is not a physical part of your body. I actually think it is.
Yeah.
So, yeah.
Well, thank you.
Yeah.
Is there anything that I haven't asked you that you'd like to add?
Oh,
We've covered a lot.
Yeah, we have covered a lot of ground. I guess the main thing is that there's always hope. And that I know in the times where things can be really bad, it's important to try and hang on through the bad time. And if the person that's struggling with bipolar disorder is willing to get help, then yes, they can come out of it. And you're right, it's going to be something they're going to manage for the rest of their life, just like diabetes, just like if you have high blood pressure, anything else like that, you're going to manage it. And I often say too, I have a friend who just got a kidney transplant, and they will be taking medication the rest of their lives so that the kidney's not rejected, and they manage. And this friend of mine, they work full time, they have a wife, and they have kids, and it doesn't impact them, but they also know that if they stop taking their medication, that the kidney will fail almost immediately. And so I say to people, yes, stay on your meds, have a really good, solid life, and just hang on. When the person and their family is in the down times and the manic phases, to hang on and to always find a team of people to help. Don't try to do it alone, ever. So, yeah.
Thank you
You're
very
welcome.
much. I appreciate you being here, Barb.
Yeah.
And on your website, do we have resources if you'd like to?
There
talk
is
about
a
your website?
resource page on my website, and I work with a group that has helped me with the website that specializes in mental health. So they will update those resources from time to time. So you can usually find fairly up-to-date resources on my website. Yeah.
Great. Thank you.
Yeah, you're welcome.
And if you want more resources that we have to offer at My Quiet Cave, you can visit myquietcave.org. We'd also love to hear from you. If you've got a topic that you want to hear as a Cave Talk, please drop us a line, let us know, give us your feedback. We'd really like to hear from you. So thank you very much, and we hope you have an awesome day.